All right, Michael, welcome to the Easy Conversations podcast. Thank you for joining me today. I'm really excited to have you on. We were able to chat offline and talk about your work and how you approach the field of psychiatry. And obviously, it sounds like you're taking a bit of a shift also. So, some exciting news you shared with me when we jumped on here. So, I'll let you speak to that as well. But it I've covered in various forms the whole controversy around medication, especially in your field. And I really appreciate the lens you shared with me, and I'm sure we're going to get into it. But often you've got camps on both sides where people are all for medication, and then there's the people that don't believe in it. And I think your approach is a little bit on it depends on the situation. I'd like to get into that as well. So before we jump into all of that, I do want to give you an opportunity to share with the listeners a little bit about yourself, who you are, and what's brought you here today.
Well, thank you for having me here. I'm grateful for this opportunity. Yeah, I think there's a lot of places to start. I think some really important things about me is that I've been very mission driven since my father passed away from cancer when I was 19 years old. And that coincided with volunteering in the hospital while he was slowly passing away, and it just clicked in me to serve others. And there was a paranormal experience that happened 2 months after that shortly after led me to also be involved in energy medicine research, specifically pranic healing. And that opened the world of alternative medicine and that integrated medicine to me. And that combination of wanting to serve others, but also this understanding that there's so many tools for healing and that humans are capable of unbelievable things, that I'm in this great position where I help facilitate people to heal themselves and make chronic mental and sometimes physical conditions become acute.
Yeah, and I appreciate that. And one of the things that you shared with me, and I'm assuming that it comes from your own personal experience, so I'd like you to perhaps talk about that too. But in your work, you really like to help people find meaning in their experiences. And that could be, I think there's something profound there when people are able to connect that and figure out, okay, what's the experience here to teach me and how can I get something out of it rather than reacting to it. And I think that gives people way more agency and I think they see things differently. But why is that important for you? And what have you drawn from your personal experiences? Obviously, losing your father at a relatively young age, how were you able to make meaning of it? And what did you derive from that experience?
So we all experience some form of traumatic experiences. And the difference between whether or not a traumatic experience becomes a mental health issue or PTSD is, I think, is meaning making from the experience. So I've had patients where, well, let's remove patients. There are people that I've met, and some of them may be patients where they may have had a sexual assault when they were younger. Okay. One person, when they experienced a sexual assault, had a family who told them that they loved them, they were here for them, and that they were going to protect them. Another person who was also sexually assaulted, no one really acknowledged what happened. They weren't told that they were loved. And that person was likely to end up having PTSD and a variety of other mental health conditions. And so the story between those two situations is that they had the meaning that no matter what happens to me, I'm going to either be loved or I'm going to be ignored and actually don't have value. What happened for me when my father passed away is that just within a couple months, I was exposed to this physics professor who I did research with for 3 years that what we think death is not as black or white as what we think. And that and the paranormal experience I had with my father's spirit talking to me through a patient is that my dad is not necessarily energetically dead. He's made that known in various ways. And so I've had life experiences shortly afterwards and even years after that where death, physical death isn't, I don't, the meaning I make out of it is that I may not be able to talk to my dad, but energetically he makes his presence known and I feel supported by him in some way still. And then he's beside me. So it's nothing that my family necessarily did in that case, but more so the universe presented me a variety of experiences where, I'm not alone. My father's around and there's a lot more magic to this world than
Mhm.
would have thought. And I would only been exposed to all this if my father passed away. If my father didn't pass away, I don't think I would see life as rich as I do now.
And that is a very difficult conclusion to come to. And I think a lot of people struggle with that is how can I look at this as a blessing when it's so tragic and painful? And I agree with you. It's all about perspective and where you put your attention to. And if you choose to look at it as something that's happening for you, that just changes your whole outlook on life. Now, the other thing you're sharing is having those experiences. Do you believe they happen to everyone, but you have to be in a place where you're willing to receive these experiences? Because I think, I mean, I can see where you're coming from, but I also feel that you have to be in a certain state of mind and have a certain willingness and openness to be able to receive as you said, what the message the universe is sending in a way.
Yes, again, very interesting experience happened within the year of my father passing away. Other people don't really get to have those type of experiences that I had. I have patients where, they lost their mother and they've been depressed even 5 years later. And they may be in a system where other family members are not really helping that person grow from that situation and actually are enabling that state of that grief. And so if I have a patient who, had a loved one who passed away, one way I often try to activate them to take more action in their life is how can you honor the spirit of this person that you lost? Imagine that they were witnessing you right now and what you've been going through. Is that what they would want for you? And are you actually honoring their passing in that way? So again, that's a way of kind of making meaning out of suffering is it makes you deeply reflect about the life that you're living. And
Yeah.
I think I've been really good at asking patients questions that really make them realize there's another way to deal with grief and actually use because there's a lot of power into not really doing anything for a couple years and being
Mhm.
like bedbound with depression. Like there's a lot of emotion in there. And if you can really capture that and move into love, service, purpose, it's making that conversion happen. And I think you have to tell a certain type of story to a patient or reflect that story back to someone to see
Mhm.
which one is going to resonate with them to really make some significant changes in their life.
Yeah. Yeah. And what is your view on the whole aspect of storytelling? And the reason why I bring that up, because one of the things I found really helpful in my journey is reading stories about the prophetic figures in the monotheistic religions. And I think they're so powerful because often the skeptics will say, did it really happen? Like, or do you believe these stories happen? But I think you can go past that. And that's not a debate whether I would want to have, or it doesn't really make sense to me, but you can actually look at the meaning in those stories. And I find often I can see a part of myself or my experience in every story. And it gives me a sense of connection to those figures and hope that, okay, they were able to navigate it in far worse situations at times, but they tied into their faith and belief that they're on the right path. So, with that being said, what are your thoughts around that and for people to connect with some of those stories at times when they feel they might be alone in their struggle?
So the main thing I do work on with patients is storytelling, because very commonly when patients come in, I ask them, like, what percentage of your thoughts involve you being mean, critical, or judgmental towards yourself? And generally it's greater than 50% with 95% of the patients I work with. And so that tells me they're telling themselves a story of bringing themselves down, and sometimes a story of hopelessness
Mm.
and lack of capability. So I do try to help patients to reword their narrative. I explain from like a neuroscience perspective that, 80 to 90% of the cells in your brain are immune cells, which is a lot. And those immune cells are going to be either inflammatory or anti-inflammatory based upon the way they communicate with themselves. So I'll give them books, resources, and again, they engage in therapy to really start working on changing the way they narrate their lives. I'll actually even talk about quantum mechanics with patients, and I'll include studies about how powerful our consciousness is on our environment.
Mhm.
And I sometimes do bring stories from the Old Testament with patients. And I would say personally, my experience of reading the Old Testament for the first time cover to cover in the past 3 years, um, I think about those stories of resilience and significant suffering from, whether it's Abraham, Isaac, or Jacob, or Joseph, or Moses. I think about their stories often, and it was actually that's what's influenced me to apply to rabbinical school,
Yeah.
and I got accepted today into rabbinical school. So I I think there's a lot of power in the stories that a lot of our ancient texts say from various parts of the world. And I know I see that in Los Angeles, where a lot of people are drawn to indigenous cultures and rituals or ancient practices, because today's culture, we're telling stories that are not really sustainable or ethical or brings people together.
Yeah. Yeah. I agree with you. And I
And
think part of it is we're also truncating things, right? Like you see people's attention span is so limited. So if you can't engage someone in 30 seconds, then you're going to lose their attention, right? And
yeah,
sometimes to truly understand, like if you think about even the story of Moses, it's pretty long and you have to really sit with it and really see it, the entire thing play out and really come to a conclusion on what is the story trying to tell you about pursuing the truth and the resilience as you touched on. What
yeah,
is how did he become resilient despite all the adversity
yeah.
in that story alone?
One very important highlight of a lot of these stories from the Old Testament is, like, for example, Moses. He was, I think, shepherding for like don't know, it's like between 40 to 60 years before the burning bush appeared to him. And I think it's a lesson of how important it is to trust the process of the universe. Like if you have a daily practice, such as like manifestation practices, and like you're expecting something to appear within a week or a month or a year, you really need to trust that certain things are not showing up because it's just not time yet. And about consuming content, I think it's really interesting that, yes, a lot of our content are now into like 30-second to minute long reels. At the same time, the most popular forms of media are podcasts where people are having conversations. And the reason why I think it's so popular, even despite like a lot of Joe Rogan's podcasts, for example, they're like 2 to 3 hours long. Okay.
Yeah.
I think what that highlights is that people are thirsty for connection with other human beings.
Yes.
That when they listen to a podcast where someone's like in conversation, it's like they're there sitting there at the table and they're just watching two people talk. And
Yes.
it's a good sign and a reminder that we're here to connect with each other, and versus like being lectured to. I don't like being lectured. I can't. I had a hard time in school like being lectured to for 8 hours. I think we want to discuss things. We want to
Mhm.
reflect on things in the presence of other people. So even though things seem like they're in disarray, I think COVID reminded us, and just our abundance of technology, like we just want to connect. Like people want to deplug and just talk to other people, and whether it's virtually or ideally in person.
Yes, absolutely. Yeah. And there's something you said a few moments ago that piqued my interest, and perhaps just a segue from the whole trusting the process piece. The whole notion of, like you said, quantum physics and how our consciousness can influence our reality, and what we pay attention to can often become our reality at times. Are you able to expand on that based on your view and how you see it basically unfolding?
Yeah, I think a great um, intro study that goes into this is this experiment with a plant where a human being was in one room and a plant was in another room, and the human being, who was a male subject, was told to imagine burning a plant
Mm.
in his own mind. And when he would do that, they would measure, I don't know if it was like chemicals or certain signals that the plant was emitting. And the study showed that when the guy was imagining burning the plant was reacting to the human being burning the plant in his mind. And so you can imagine if you're someone walking on the street or you're going to a party or a dinner, and you have this narrative of distrust, replaying your mind of how horrible the day was, it can impact potentially the thoughts of the people you're around. Times that into so many different life situations, including
Yes.
parenting your kids as well. If you're a parent, you might not think, hey, I was never really verbally abusing my child, mostly present, but kids might actually develop some form of reaction long term of like being in a household with someone who is miserable
Mhm.
with themselves and stuck in a very negative thought cycle.
Yeah.
Um, and just thinking about what was the not the experiments in quantum mechanics where when you're observing an atom versus not observing, it changes the characteristics of the atom. To me, it just means that the way you narrate your life, that's what you're going to get back
Mhm.
in terms of the things that are going to happen to you
Yeah,
in the long term. Um,
absolutely.
yeah.
Yeah, and even the characteristics you embody will often determine your like situational outcomes or your reality, right? That's kind of what I'm hearing from you as well, and I'm a firm believer of that. If you're someone who believes in love and peace, those are the situations you're gonna invite into your life or find yourself in, as opposed to people that are in apathy and anger or envy.
I'm gonna give a personal example that's recent from this year. So I've been on dating apps since 2012, and I get off of them once I'm in a relationship. And just thinking more about consciousness, I stopped. We're over 2 months, 2 months now. It has changed the way I engage women now, like, or the way women also engage me. Where I would say dating apps can, for a lot of people, induce a sense of like scarcity mindset and a sense of pressure.
Yeah.
That since then, it's the way I'm experiencing engaging women now is it's very different. And I don't think I'm ever going to be on dating apps again. Just from like this experiment I've done, I really think it's changed my reality in so many ways. And I think dating apps plus other factors, but I think it has affected a lot of people's consciousness involving dating, which
Mhm.
has led to a lot of people having a lot of
Yeah.
difficulties.
I think it's commoditized it in a way too, right? So you don't really look at people as people anymore. It's almost like they're a commodity that you
Yeah,
can easily replace the
yeah,
very same day,
that's right.
unfortunately.
Yeah, yeah.
Yeah, for sure. Now, to, I do want to understand your philosophy on psychiatry, like when it comes to how you approach patients or clients. What is your philosophy? Because I do want to get into some of the controversy, as I touched on it at the beginning, and some of the criticism that your field will get from time to time. But yeah, I just want to draw that out a little bit to set the stage, and then we can get into some of the other stuff that we see nowadays.
On paper, people think I'm very paradoxical. Tell me why. I love what I do. I really enjoy it. Okay. However, at the same time, I feel like psychiatry is committed as a field for the past 100 years. I think in a lot of ways, we've committed one of the largest humanitarian disasters in the history of mankind. From lobotomies, frontal lobotomies, to over medicating, which leads to a variety of side effects, overdiagnosing. So I think a lot of people have experienced a lot of harm from the field. At the same time, I think if you practice psychiatry in a way of more moderation in terms of the way you use medications, helping people slowly wean off medications, provide the proper forms of psychotherapy, doing some systems work. I've had the experience of people being at their lowest moment in their life to now experiencing the highest periods of their life. So
Mhm.
I'm in a position where I get to be inspired by the people I work with, and they've helped facilitate my growth.
Right.
And I would say it's out of the love of what I've experienced in psychiatry. I also want to become a rabbi as well, because I want to have even more tools, spiritual tools, more stories to be able to help empower my patients. And so a lot of people have thought, you really hate your field. You want to switch careers. I'm like, no, I don't. I actually view them really feeding into each other.
Yes.
And so I love what I do. I think psychiatry can be one of the most impactful fields out there. I just think there's an overemphasis on overdiagnosing, over medicating, and not really helping people to be self-sustaining individuals and be okay with people. Let's say if someone has a history of psychosis.
Mhm.
Okay, yeah, I can help someone come off of meds for psychosis. Yeah, they might have 1 or 2 more episodes of psychosis for the rest of their life, maybe 3 or 4. And it's probably better for them to experience that than being on medications that have made them gain, in a lot of cases, over 100 pounds.
Mm,
And they're depressed because the antipsychotics decrease dopamine activation.
yeah.
And so, like, they're not motivated for anything. And so, a few episodes for a couple weeks where they might be psychotic for like the next 50 years versus the next 50 years, they're not living life at all. Who am I to decide for that patient, hey, I strongly recommend you to be on the medication. I'm going to leave it to the patient. And I do leave it to the patient to decide, hey, these are the risks and benefits. If you want to be off of antipsychotics for schizophrenia or another psychotic disorder, you need to get great sleep. You need to eat well.
Right.
You need to stay connected. Avoid THC. Avoid other mind-altering substances. If someone lives and they have a good relationship with themselves, yeah,
Mhm.
they're at low risk of having another psychotic episode. So I think from what I've heard from other patients, it sounds like the discussion of informed consents are not really happening in a lot of clinics. And so I really make an emphasis on really providing comprehensive informed consent so that patients can make a really good decision about their relationship with medications.
Yeah. So thank you for that. So what I'm hearing from you, there's obviously a place for medications in certain circumstances, but what you're also pointing out is unfortunately, there's been over medication that's taken place. So from your perspective, again, it depends. It's case by case, but how do you? I know you're saying that you give the kind of the choice to the patient, but are there instances where you recommend medication to patients?
Yeah. So, for example, let's say you have a patient who has a history of multiple manic episodes or psychotic episodes. And again, often in a lot of the cases, I see a lot of the cases induced by either psychedelics,
Right.
least use of psychedelics, or THC stimulants, and even psychiatric medications that can lead to it. I tell them, like, I don't feel comfortable you weaning off your medications because the way you narrate your life is really negative still. You are still smoking a lot of marijuana. You don't really have any sense of meaning or purpose in your life, or you're not even trying to like find that. You're very lonely and you're getting 4 hours of sleep per night and you're not even exercising. So I really highlight all the different factors that make it a high risk for them to have a relapse. And
Yeah.
so I'm going to be more firm with the recommendation of you need to still continue taking your medications. So I have a lot of patients that are medicated still.
Yeah.
A lot of those patients, unfortunately, are just they don't have the support system. They might
Hmm.
have limited finances where they really have a hard time working on all those different things. Because those are a lot of things to do. Improve your sleep, exercise,
Yes.
diet, being in good relationships, finding purpose like that. I mean, in today's age, that's hard for a lot of
Hmm.
Americans.
Hmm.
Um, yes, I mean it's it's I've come to the point where we really need some type of significant social restructuring of our society to really help people. I think a lot of psychiatrists and therapists are kind of set up for failure when society is not built in a way that's sustainable for the human species in
Yeah.
the U.S., for
Right.
example, in other
Yeah.
developing countries.
So what I'm hearing from you in that context, at least, is often it's just lifestyle changes that people need to make, but one of the things you had mentioned to me was the medication can act as a spotter, but then the challenge is how do people get off the medication once it's no longer needed?
Well, that's another whole discussion. When someone has done the work and they're ready to come off, another reason why they need to be in like really good like shape physically, mentally is that the withdrawal symptoms can be very significant for a variety of medications, and it can take weeks, months, and sometimes years to come off of certain medications. And I think a lot of patients are not aware when they first get started on medications, they're not aware of this potentially multi-month or multi-year long process of coming off medications. And a lot of them say, if I knew I was going to be like this, I would have never agreed to be on it in the first place.
Yeah.
But there's a lot of, I'm not trying, I don't know why I'm laughing, because like I'm trying to match the sadness of it, where my experience of engaging patients that have been in the mental health system for a while and they see me, there's so much anger. Sometimes that anger is like not necessarily directed towards me, but like I hear it.
Right.
And it's intense. The anger is very intense. And I really try to do my best to convert that anger into really trying to get someone to focus on doing the things they need to do to
Mhm.
take care of themselves, to make it a less tortuous process.
Yeah. Yeah. And one of the speculations around the over medicating piece is there's obviously money involved, and often the doctor themselves will be benefiting in a way to prescribe. When you hear that, what are your thoughts and how does that make you feel? Because this is an area you work in to hear. And again, I mean, there's bad actors everywhere, right? But how does that make you feel about the field? And what are your thoughts around that speculation?
Um, I kind of just view it as a way of life at this
Yeah.
point, because I feel like in any industry, whether it's law, the financial field, politics, it's kind of everywhere.
Yeah.
So I guess I'm not surprised.
Mhm.
And I used to have more feelings of anger. And for me, it's exhausting, angry for a long
Right.
period of time. And so I've converted anger, frustration, in disbelief into solution of what can I control within my own community, and also
Mhm.
networking with other people who
Right.
have great tools for healing, and just slowly building potential coalitions towards not keeping things as status quo. And I think with technology and social media and AI, people have access to information for healing more easily than they ever have before. So I think, for example, AI and technology really sheds light more than ever on the corruption that's going on. And we're making it much more accessible to have these types of conversations. And
Mhm.
they're very mainstream. Whether or not you know, whatever your beliefs are about RFK Jr., the fact that he gets to be the Secretary of Human Health Services is shows you that like, things are things are changing in the world, especially in the United States, which a lot of people think is one of the most corrupt countries in the
Right.
world. It causes a lot of pain and suffering throughout the
Mhm.
world, and it's not the best influence. We have an opportunity to be a positive influence on the world of healing.
Yeah, and I agree with you. Like the corruption exists everywhere. But I think with psychiatry, it's one of those fields where unfortunately it's like directly it affects people's mental health and brain health. So there's that added layer and perhaps responsibility that comes with the profession.
That's why I did say it's the largest humanitarian disaster, is because psychiatrists are in a position to narrate for a patient what their life is experiencing going to be for the rest of their lives. So I have patients that tell me, my doctor told me I'm going to be, this is a quote, these are actual quotes. My doctor told me I'm going to be depressed for the rest of my life. And these are like, this is what that's a horrible narration to carry. That's not a hopeful narration. And it's a narration where someone is automatically going to place a limit in what they can achieve. And so, yeah, you can make the argument that certain stories that psychiatry, the field of psychiatry, has played into is one of hopelessness and limited potential, which has, we see what one human being can do. Millions of people have unfortunately been playing a narration of limited opportunity.
Yeah. Yeah, for sure. And the other narrative I hear a lot of people, for some reason, and I do want to get your thoughts from your perspective as well. For some reason, they believe they have a chemical imbalance, and that's why they need a medication to help balance things out. And I often think that's ridiculous if people have already convinced themselves that they have a chemical imbalance. Have you heard that? And what are your thoughts when you hear that perception of a chemical imbalance in their brain?
There's been a lot of peer-reviewed studies that have pretty much negated that theory of mental illness. Yeah, I have also, like, just from clinical experience, have seen, like, it's not, I haven't seen it really come into fruition. And again, studies have really played into that. For me, for the theory of mental illness, what are we actually seeing a lot of the time? I think my clinical experience, 90% of the time, it seems like it's related to unresolved trauma or past life experiences that have shaped a negative narrative in life, which leads to depression, anxiety, obsessive thoughts, eating disordered behaviors, drug use, sleep issues. I mean, if you look at the symptoms of PTSD, it encapsulates so many different symptoms that you can really make the case that, again, 90% of those cases are related to unresolved trauma.
Mhm. Yeah, yeah. Which probably it's good to circle back and bring in your own pursuit here of becoming a rabbi and building the spiritual side into your work. And I know we touched on it a little bit around meaning making and people looking at adversity in a way. So I guess then the shift needs to happen. Well, maybe I don't need a medication to heal this. Maybe I need to just look at it from a different lens. How do you see your role, like as you pursue becoming a rabbi and integrating the two? And I know you touched on it briefly, but the spiritual component in the work, because it's not common. And I see it and I see a lot of value in it. I'll use my intuition with clients if I feel that they're willing to have those conversations. We'll broach that topic. And I see a significant shift in their growth and in how they're able to deal with some of the challenges they're having. But I do want to get your thoughts in how you plan on integrating it into your work.
Yeah, I for example, let's say I meet someone who's an atheist. Okay. Even if they don't have a belief in an afterlife or in a higher power, I can still have them, they can at least admit to and appreciate the sacredness of human to human connection. Something magical is happening beyond yourself. And that in
Yes.
itself can be spiritual and sacred. And so, as I already do this as a psychiatrist, but as a rabbi, I whatever faith the person comes from, or whatever community they come from, I just want to instill in people the value of going beyond themselves. And at the least, if that's just human connection and giving to others, combined with rituals. There's all types of ceremonies from culture to culture. There's different places of worship. There are people that make up their own set of rituals that they find meaningful. So I want to be able to have these conversations with people outside the clinical setting. So I think professionally, I wouldn't say it's fatigue, but I want to be able to make an impact on the community before they go into a depressive episode, before they go into an anxiety episode. I want to be more preventative in my work as a rabbi. And I'm seeing are downstream effects
Right.
of a lack of spirituality, a lack of purpose, a lack of rituals, and a lifestyle or a lack of a lifestyle that is connected to a belief that goes beyond themselves.
Yes. Yeah. So what I'm hearing from you is often when you're seeing patients, it's already too late in a way. I mean, it doesn't mean they can't get back on track, but they've already suffered the consequences of not having some of those things you're touching on. Whereas being in the community, knowing what you know, and some of the challenges that can come from negating those things or not neglecting them in a way, then you already know the consequences of that from the mental health side. So you can structure the two together and be a bit more upstream as you shared.
Yeah, because there's a lot of work. There's a
Yeah.
lot of work to be done. And with how our society is oriented towards being more and more lonely and less dependent on others, we need to get in there as soon as possible to really get people to engage in some sort of spiritual practice that grounds them and informs every action that they take in life.
Yeah. And again, to kind of touch on something you mentioned earlier, unfortunately, the way society is structured today, and I don't know, I like to think it's not by design, but part of me does feel like it's by design to create divisiveness amongst us, which prevents connection, which I think, obviously, as you and I both agree, affects our mental health. What are your thoughts around that, right? Like, since the pandemic, there's been more and more of it, right? There's division in the political views people have, even views around COVID. People had such extreme polarizing views. You see that in all facets of our social structure, and that's not helping people, right? I think people are struggling, especially if they're losing connection with family members and friends, loved ones. And if they don't have the capacity to tap into their purpose at times, then they're really suffering. So again, just want to get your thoughts on some of that stuff.
So I partially take issue to what you're describing right now because you might be just from the statements you just made about divisiveness is that you're actually shaping people's consciousness about what's actually happening in reality. Because unfortunately, a lot of our perception of reality is informed by social media. Because if you bring a room of people, if you bring into a room of people in person and people just start communicating, they might not have that experience of all that, like there's any divisiveness.
Mm.
But I think in this day and age, we overconsume social media and not just overconsume, but like we have such more limited human to human experiences that virtually we don't see any other form of reality but just divisiveness.
Mm-hmm.
My message is that use technology to get more skills and tools and to connect with other people, I would be more cautious about using social media to get a sense of like what's happening
Mhm.
in the world because it's so biased towards divisiveness.
Yeah.
Yeah.
Yeah, I guess it gets people's attention, right? So there's a reason why the algorithm will spit that out.
Yeah.
Yeah.
So again, how divisive is the world? Based on social media and based on polls, which is still based upon people's conception of media. Yeah, it's high. I can confidently say, just from my in reality experience, a lot of people are disconnected from themselves because that's what I see like in my human to
Yes.
human interactions.
Yes.
People are disconnected. I can confidently say that. But in terms of divisiveness, I'm seeing a lot of my experiences in person these days when we talk about different subjects. I consistently see we have a lot of similarities in terms of
Mhm.
thoughts and beliefs.
Sure. Yeah. Yeah. No, I appreciate that. So thank you for that, Michael. And thank you for coming on and sharing your personal journey and all the work you're doing and where you see room for improvement in the field. And definitely you're taking some steps to add to that and being a huge part of the community, helping people. So I really appreciate your time today. And for listeners that want to learn more about your work or just find you online, if you'd like to share, what are some ways you can do that?
Yeah, for any resources or direct work clinically, they can find me on www.hope-therapy-center.com. And then for any coaching or consulting anywhere in the world, they can find me at www.iexperience.life.
All right. Perfect. We'll put that in the show notes. But thank you again, Michael. This was a pleasure, and it was great to connect with you.
Yeah, I had a great time talking to you. And again, it's been a great opportunity to be here with you.